In a groundbreaking gene therapy trial, a young child from the UK has become the first in the world to have their hearing restored. Greetings, everyone. Today, we are excited to delve into a revolutionary gene therapy trial that has captured our attention. This trial focused on a remarkable case involving Opal Sandy, an 18-month-old toddler from the UK who was born deaf due to auditory neuropathy. However, thanks to an innovative treatment, Opal's hearing was successfully restored. The procedure involved introducing a functional gene into her ear, resulting in a near-normal auditory experience. Spearheaded by the esteemed Professor Manohar Bance, this trial has shown immense promise and offers hope for others facing similar forms of deafness. The exceptional outcomes witnessed in multiple children participating in the trial have opened up a new chapter in the treatment of deafness. So, without further delay, let us embark on this fascinating discussion. After becoming the inaugural participant in a groundbreaking gene therapy trial, a young girl from Britain has successfully regained her hearing, marking a significant milestone in medical advancement. Due to auditory neuropathy, Opal Sandy was born completely deaf, as this condition interferes with the transmission of nerve signals from the inner ear to the brain. After undergoing a single treatment, the hearing of the 18-month-old has significantly improved and shows potential for further enhancement. Opal received treatment at Addenbrooke's Hospital in Cambridge, where Professor Manohar Bance, the head of the trial, expressed his pleasant surprise at the results, stating that they exceeded his initial expectations. He also expressed optimism that this breakthrough could potentially lead to the cure of others suffering from similar forms of hearing impairment. The outcomes from the Opal study are truly remarkable, almost reaching a level of restoring hearing to normal. This gives us hope that it could potentially serve as a cure. Auditory neuropathy is often a result of a genetic mutation in the OTOF gene, which is responsible for producing otoferlin, a crucial protein that facilitates communication between the cells in the ear and the hearing nerve. In September, Opal, a resident of Oxfordshire, underwent surgery where her right ear was infused with the working gene, thanks to the innovative treatment created by biotech company Regeneron. Astonishingly, her parents observed noticeable changes within just 4 weeks, and the improvements became even more pronounced after a remarkable 24-week period. Mrs. Sandy, along with her husband, Mr. Sandy, were left in a state of disbelief when their daughter responded to auditory examinations at their residence without the use of her cochlear implant, which is typically employed to manage her condition. Initially, I believed it to be a mere coincidence or perhaps a sudden alteration in the lighting that had captured her attention, but I decided to repeat the test multiple times, Mrs. Sandy recounted. According to reports, she has developed a newfound appreciation for the satisfying sound of cutlery hitting the table, as well as engaging in playful activities with toy drums and wooden blocks. Adding to the conversation, she mentioned that during the previous assessment it was communicated that her hearing was almost within the normal range. It appears that they recorded some level of response at approximately 25 to 30 decibels. Based on my understanding, typical hearing is categorized at 20 decibels, and she is quite close to that level. Previously, she had absolutely no ability to hear. According to Professor Bance, the surgical procedure performed on Opal closely resembled the process of fitting a cochlear implant. During the procedure, a catheter is used to infuse the treatment into the opened inner ear cochlea, with the entire process taking approximately 16 minutes. According to him, in order for the treatment to pass through the ear completely, it is necessary to create an additional opening in a different area of the ear. The method employed for this treatment closely resembles that of a cochlear implant, with the exception being the absence of an actual implant. Instead, the focus lies on repairing and sealing the affected area. According to the speaker, this gene therapy has the potential to usher in a new era in the field of deafness treatment. He expressed his awe and admiration, remarking on the extensive duration of research and effort that had preceded this breakthrough. The culmination of decades of work had finally yielded tangible results in human subjects, which he found truly remarkable and inspiring. A specialized treatment was created specifically for children with OTOF mutations, and another child who underwent the same procedure is also experiencing favorable outcomes. The trial consists of 3 components, where 3 deaf children, including Opal, receive a small dosage in only one ear. A different group of 3 children will receive a concentrated dosage on a single side. Subsequently, if deemed safe, a fresh cohort of children will be administered a dosage in both ears simultaneously. A total of 18 individuals from the United Kingdom, United States and Spain are currently being enlisted for a comprehensive 5-year study. On Wednesday, the findings of the research were shared with the attendees of the American Society of Gene and Cell Therapy Conference in Baltimore. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.